There's so many emotions that go through me because there is so much that goes into nursing, especially these last 2 years. It's the art of caring, compassion, strength. There's a lot of inner strength. It's the calling. And we see that in every single nurse at Mercy Hospital within Catholic Health System.
I say icon. When you talk about maternity care at Mercy Hospital, the first person you think of is Marianne. She is well known in the community. She's well known throughout the hospital. She comes in on weekends, on holidays, because she's really accountable to what she's responsible for. She's here all the time. She's irreplaceable.
She is. She is very knowledgeable over everything that's done in this hospital. She has a thirst for knowledge, and she likes to share it with others, which is beneficial to me in my position and to my staff.
Does she have a sign, a little placard on the front of her desk that says the buck stops here?
She doesn't, because that would be for mortuary affairs if she did.
Uh-oh.
She's in charge of that.
She's in charge of that too.
She's very well-rounded.
I'm very proud to have been selected as the Nurse of Distinction for 2020. It was just a surprise and a wonderful honor. It really is a tribute to all the nurses that I've worked with through the years, those who were so influential in mentoring me, my preceptors, all the women that I've worked with, women who ran the clinics and really had been such good role models. And I think of them when I received that award. I was very, very, very taken back.
Excellence. Anything Alex touches turns to gold. I've known her for 7 years, and in that time I've just seen her flourish beautifully. She's the epitome of everything you hope to have in a friend and as a nurse and a colleague. She's the biggest cheerleader for nursing I've ever met.
Alex is a exuberant nurse. She makes me so proud. She takes the evidence-based practice and she applies it. She is a champion within the CVICU. She was chair of her unit practice council. She is a joy and brings, again, an exuberation to her whole team.
I had an internship, I had two actually, one at a school for children with special needs, and the other one was at Buffalo General on a stroke unit, and it was just to go there and pass water pitchers, basically. I couldn't do anything, I was a college kid, whatever. And I remember the moment I turned the corner and looked into the unit, and the paper charts were everywhere, and there's hustle and bustle, and alarms are going off, and I remember in that moment, I was like, this is where I am supposed to be. And when Peggy told me that I was the recipient of this, I couldn't be more honored, and I want other people to see my excitement and my passion for nursing and kind of take that and carry that with them as well.
I will say thorough. Alex has been just a tremendous asset to the hospital in championing and helping to champion the work of our stroke team, and without her presence here, I don't know where we would be. But as I said, she's one one person on a great team. But she's just a fantastic resource for all of us, and has been really instrumental in helping roll out best practices for stroke care in the emergency room here at Mercy.
Superhero of stroke care. Alex has pulled off something that most mortal beings could not do. It has partly to do with her experience. She worked on the stroke ward, she worked in the ED, she's worked in different jobs in the hospital, and as a result, she's been able to amalgamate all those experiences and come out with a dedication and a plan for treating stroke patients that's unparalleled.
In the pre-hospital setting, a lot of times there's a knowledge gap in what happens once we reach the hospital. I'm an almost 20-year paramedic, and coming into working at Mercy Hospital and working with Alex Foley, I can tell you I have learned so much about stroke care in the hospital, because that's just not a piece that EMS gets. And as soon as I started working here, Alex reached out immediately and said, hey, we can team up and we can improve stroke care in the pre-hospital setting. So not only does she improve the stroke care in the hospital, but even before they get here, she is determined to make sure that every pre-hospital care provider in Western New York has the knowledge and education that they need to appropriately care for our stroke patients.
Determined. She works tirelessly to standardize the care that we provide across, for all of our stroke patients across all of our Catholic Health System hospitals. She's always advocating for the needs of our stroke patients, and she's very passionate about what she does here.
They say that nursing is a calling, and I guess it's one of those things that you end up in sometimes and you don't really know why. I grew up in a medical family, and my grandma was a nurse, and I think that that probably has something to do with it. When your whole family is surrounded their life and made it work around service of different types, it's kind of easy to fall into a career service like that. It's a really proud moment for me, having other people recognize how hard someone works and how much you invest into programs or your job every day. It's something that we don't stop and give ourselves a pat on the back, but it's a pretty big pat on the back and a very warm and welcoming feeling for other people to recognize how much you've done for someone or something.
Really remarkable woman. I think that's what I think of when her name comes to mind. You know, she is someone that I truly admire as a person and as a nurse, and I have been so fortunate to been able to learn a lot from her. She's very straightforward, very to the point, very ethical, very honorable. You know, she's incredibly thorough when it comes to her patients and ensuring that they are cared for appropriately.
The excellence, she exudes excellence in every single thing that she has done. I've known her, I've had the privilege to work with her for many, many years, and she is the nurse that you want taking care of you and taking care of your family. Her attention to detail is amazing, and she sets the bar very high for herself and her coworkers.
Jennifer has a quietness about her that is powerful through her silence. She will champion the under-champion. She is there for the underdog. She is there for her staff members. She will present an argument with such a high emotional intelligence, which is guided by her professionalism. She loves her patients and she loves her community, and she's a great role model. We're so proud to have her on our team.
Well, I chose to become a nurse when I was only about 18 years old. I was going to go to what I thought was medical school, so I went into Erie 1 BOCES in my senior year, started in the LPN program, and decided from then on that this was my true calling, nursing, and I'm not going to be a doctor. I want to be with the patients, and my mother's a nurse, so I kind of knew what that entailed, so that's where it started. It's very humbling. I certainly do not feel that, especially in the year after the pandemic, that I should be receiving that award, because every single one of us was the outstanding staff nurse during that year. So I'm blown away and beyond humbled, and I really believe that I'm just one person, that it stands for every person that has worked through the pandemic, you know, in mercy, because we've all worked together, and every single thing that I do every single day is not a one-person job by any means. Every department supports one another, so it's a big collaborative thing. So it's very humbling and I feel very honored, but I also want it to be known that this isn't just my award.
I am so proud of these nurses and what they have done in the last couple of years, and even prior to COVID. It's the resiliency, coming together and having one voice and building the nursing profession.